So a few stretches that we can do sitting in a chair, and a couple of yoga positions, again, seated positions that we can do. I like to do my stretches as part of my cool down so that our muscles are all warmed up. We don't want to necessarily stretch cold muscles. So even if your warm up is just walking around for a little bit, you can go ahead and do a stretch after you've moved a little so that your blood is flowing, you're a little bit warmer. We don't necessarily want to start with a stretch without doing any kind of warm up. So personally, I aim for having them at the end of my exercise, especially so that I can then focus on any muscles that I was really strengthening, making sure that they get a good stretch. If they're feeling tight, sore, anything like that, that stretch can really feel very nice. So that being said, we're going to start with our hamstring stretch. So the way we stretch our hamstrings is generally your knee is going to be straight. You want to reach over, touch your toes. So when I'm doing it sitting in a chair, I'm going to sit kind of towards the edge of my chair. I'm going to be leaning against one leg. This one, my foot is flat on the floor, knees bent 90 degrees. So this arm is going to help keep me from kind of falling forward out of my chair. And I'm just leaning forward and trying to touch my toes. So get this down a little bit so you can see better. So my hamstring stretch is going to be leaning forward, down towards my toes. Whenever I'm doing a stretch, I want to hold it for 30 seconds. If I can't hold this position for 30 seconds, I'm going to just bring my arm down my shin and go as close to my ankle or foot as I can and still hold it. So if you're feeling any burning pain in the back of your leg, you really probably should go a little bit less. Sometimes this position can irritate if we have sciatic pain, so you want to be aware of that. Nerve pain especially, it tends to feel more like a burning pain versus the muscle stretching. So if you're feeling that, stop and let somebody know and don't do it. So generally, I'm going to hold for 30 seconds and then I'm going to bring it back up. I like to alternate legs. So usually I'm aiming for about 3 times, 30 seconds each. So because I'm going to be going back and forth, I'll do one leg, then I'll do the other, switch, do it again. That was certainly not 30 seconds, but you can set a timer, watch the second hand on a clock, whatever works best for you. You can count in your head, but a lot of the time when we're counting in our head, especially if we're doing a stretch, we count more like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 versus 1, 2, 3, 4, 10. So we just want to make sure that we're aware that it's a true 30 seconds. Research has shown that you get more benefit out of a 30-second stretch than anything less than that. So sometimes people will do like 10 to 15 seconds. Certainly isn't necessarily bad. You're still stretching the muscle, but you're going to get more stretch, more lengthening of that muscle by doing that 30-second hold. So we really want to try and aim for 30 seconds as much as possible. Again, if it's too uncomfortable for you to hold for 30 seconds, then dial it back a little bit. Don't go quite as far. You don't necessarily need to stretch that far. Even if you get down there and you're okay at first, and then, oh, that's starting to get uncomfortable, and I have to come up just a little bit, that's perfectly fine and acceptable because it's better for you to do what you can and work within the range that you can without irritating anything. But again, still aiming for 30 seconds, even if we're not doing that as far of a stretch for the whole 30 seconds. Okay. Next is going to be trunk mobility, so getting extension and rotation in our trunk. So for this one, I don't necessarily have enough extension to be able to show this well, but extension will be sitting back and shoulders back, head back, and rotation. So for the rotation especially, we can kind of turn in our chair, use the armrest to help get a little bit more movement through our spine. Again, my back doesn't necessarily do this, so I'm going to tag in a friend real quick who does have some extension so I can have her do it. What am I doing? You're just going to do extension and rotation. So start with just thoracic extension. For this one, I like doing arms overhead. Can sometimes give you a little bit more of a cue to really get that backward movement. And you're only going to go as far as you can without necessarily falling into the chair. If you go as far as you can and still touch the chair, that's fine too. Just making sure that you're not falling into it. And if you notice her feet are coming off the floor, she's using counterbalance. Come on back down. And then go ahead and rotate either direction, doesn't matter. And so then that's the rotation. And again, you can see how she used the armrest to help get that little extra pull. That's perfectly acceptable. And sometimes you can get a little bit more movement through your trunk, getting that thoracic spine, especially to move by using those. Thank you. That one that she did, the second one is also our chair yoga, the seated spinal twist. So that's a really good way to get that extra rotation through there. So next we've got our ear to shoulder, which is lateral cervical flexion. So basically I'm just bringing my head to the side, and my neck is very tight, so this is definitely needed. If I want extra stretch, I can either sit on my hand. This is gonna get a little bit more down into my upper traps versus my scalenes. So depending on which one I'm targeting, and I usually like to do a little bit of both. So I'm gonna get some stretch up here. Anchoring my hand is gonna also get me a little bit of stretch down there. You can grab the chair too. Personally, I don't like to, because I feel like sometimes if I'm trying to grab, I'm activating muscles, it makes it harder for me to relax my neck. So I really want to make sure that I'm doing whatever works best for me to be able to relax my neck and get a good stretch through here. So my head is coming straight to the side. I'm not going forward with it, but just sideways. Okay. Okay. And I want to make sure my nose stays pointing forward. I don't want to rotate it. So if I notice that I'm either looking down at the ground or looking towards the ceiling, I want to correct that and make sure that my nose stays forward and it's ear to shoulder. Again, we want to aim for 30 seconds each. So that one is going to get our scalenes, which are in the side of our neck here, as well as our upper traps, which is the top of our shoulder. So the next one that I like to do for the neck, is going to be our nose to armpit, which is basically cervical rotation plus flexion. So I like to tell people nose to armpit because we want to turn our head towards our arm, towards our shoulder, and then we're thinking of aiming our nose down towards our armpit. So again, if I'm sitting on my hand, I'm going to get a little bit more movement. I'm going to rotate first, then I'm going to come into that flexion. And ideally, I should feel the stretch kind of through the back of my neck and possibly into the top of my shoulder blades and my rhomboids, depending on where I'm tightest. It's going to be a little bit of levator, a little bit of rhomboid. Really depends on where your restrictions are. Okay. So for these, the neck muscles, we really want to make sure that the securing arm is going to be opposite where we're moving. So if I'm trying to stretch towards this armpit, that's not necessarily going to give me as much extra stretch as this one. Then just general neck mobility. So this is going to be moving our neck through the whole range of motion that we have. Want to make sure that you're going slow, careful, controlled. We don't want to do any fast movements with our neck, especially as we get older. Things go snap, crackle, pop. It's not really a comfortable feeling. Also, obviously, don't want to get dizzy or anything like that. So I like to start with just straight flexion and extension. So the flexion will be my chin to chest. And then extension. When I'm doing the extension, I'm going to start with my neck straight and kind of tip my chin up first. That's going to get those first couple of vertebrae in my upper cervical to go into extension first. Then I'm going to get the rest of it by letting it go through the rest of my neck and really getting that chin to the ceiling. Okay. So same with when I'm coming down towards my chest. I like to do the upper first, so I do this chin tuck, and then I bring my head down the rest of the way. I find that just gives me a little bit more stability through it, so it doesn't feel like I'm necessarily making the joints really hate me too much. So the other mobility that you want to make sure is the rotation. So for this one, this is our circles, and you can do the whole circle, just being slow, careful. You can also just kind of do a rotate, looking over each shoulder and doing a true rotation versus the next circles. Personally, and this is because I feel every little snap, crackle, pop in my neck when it's doing that, I don't really like this because I feel like it's harder for me to keep the stability in my neck. So I like to kind of isolate it and really do the chin tuck to chest and to the ceiling, and then do more of a direct rotation versus the circles. It's just a personal preference. As long as it's not uncomfortable or painful, then you can go ahead and do the circles, whichever is better for you. Seated spinal twist, Emma already took care of for us. Seated cat-cow. So the cat-cow is basically going to be arching our back and then flattening our back out. So again, this is one that I am not necessarily going to be the best at showing because I literally have almost no movement in my spine, but I'm going to do our best. So the cow is going to be pushing so that our back arches more. So I'm really stretching into my lower back versus before with the extension I was kind of moving a little bit of all of it. This one is really just thinking about letting that arch come through. So I'm arching my back as much as I can, and then I'm going into my cat, which is going to be pushing my belly button backwards and kind of flattening my spine out. Okay. So cow and cat. So for the yoga ones that are a little bit of a stretch but more of a mobility, I do like to do more of a like 5 times 10-second hold instead of just in and out, and I don't necessarily want to hold it for that full 30 seconds. So I usually will go in that position, hold for 10, 3, 4, 5, 6, 7, 8, 9, 10, and then back. Okay. The next one will be our triangle. So, triangle is basically going to give us our lateral flexion through our trunk. So for this one, we want to start with our arms out to the sides, and we're going to come tipping over like I'm a little teapot, and we're trying to get as much stretch through the side here. So again, my spine doesn't really move, so you can kind of see that I'm more doing a straight tip angle, not getting a lot of movement, but I'm aiming to try and push my rib cage out on this side. So I'm almost thinking of if somebody were pushing my ribs over as I'm going, so that I can really get that movement through there, okay? And as we're going down, we want to try and aim for having our arm coming down our leg. We can get a little bit of this. We'll get a little stretch through our hip muscles as well. Again, where I put my leg and my arm position is going to depend on how flexible you are. So this is a lot of stretch through the inside of my thigh here versus when my leg was out a little bit, but I was kind of coming down the back of my leg. Not quite as much of an adduction stretch. Okay. The other way is just keeping your feet flat and doing more of a trunk lateral flexion. That's fine too. Okay. Just really being aware of whatever is limiting you, whatever you're feeling the stretch first, making sure that you're okay with it. It's not an uncomfortable stretch. It feels like something is too painful or not stable, then obviously you don't want to do it. Next is our child pose, forward fold. So this one is just going to be flexion of our spine. We're just kind of leaning forward. I like to hug my knees in this position. I also bring my chin down to my chest. And I'm trying to get a nice round back throughout this so that I can really get that flexion all the way from the base of my spine through my neck. So that's part of why I'm going to do the chin tuck as well. So as I'm coming down, I'm going to grab behind my knees. And then I'm going to give a little extra pull with my arms. And come as C as I can make it. The other way that we can do that forward fold is with our legs apart. And we're going to kind of come down in between our legs. So for this, my hands are kind of coming down to the floor. This is going to get me a little bit of a stretch through my adductors here and the inside of my thighs. I can bring my hands down and kind of secure them on my ankles to give a little extra pull if I want. But again, mostly I'm trying to get that movement through my spine, that nice, long, slow stretch. So, next one that we want to do is our knee to chest stretch. So this one, I can just bring my leg up towards my chest. I can, if I'm flexible enough to bring it this far, go ahead and put my foot on the chair, okay, just to help that get into the position. Once I'm there, I want to try and keep my foot up, and I'm just kind of hugging my knee to my chest, okay? One leg, other leg. You can sit forward and do this. We're trying to get a little bit of a stretch through our glutes. To an extent, we're also going to get that same when we do the hug down, but the knee to chest gives us a little bit more. Kind of an isolated. And then our figure four or piriformis stretch. So piriformis is a muscle that's deep in our hip. It's one of our lateral rotators. It is also a muscle that can be responsible for some of our sciatic pain sometimes. So sometimes when people have sciatica, one of the things I will suggest to them is to try piriformis stretch. Even if the sciatica is coming from your lower back, it's not necessarily a bad thing to do. So true figure four. I'm going to show you on my good leg first. So we're kind of making that tailor position, so ankle is over my other knee. This is where the four comes in because the way my knee is angled right now. A little extra stretch can be applied by pushing through my knee here. I like to use my forearm versus my wrist just because then I can kind of lean into it and get a little bit of a stretch. Depending on where you're tight, you're going to feel in different places. So when I lean like this, I feel more of a hip flexion, stretching, and almost pinching. Not necessarily a very comfortable sensation. So the other way that I can do it for me to get more stretch in my piriformis directly, which means that I'll feel it really, really deep down in my butt cheek, is if I kind of hug that knee. So I like, because I don't want this leg to fall, kind of securing around the ankle so that my leg doesn't come forward too much. I can still push down there if I want, or I can just hug my knee up towards my chest, okay? Some people get more stretch with the push. Some people get more stretch with pulling their leg up towards them. Again, it's one of those stretches where you're gonna feel it differently. Every person is gonna be a lot different. So this is my bad. Really, it's not even the knee, it's the hip. So on this side, I can't get my knee straight. So in this position, this is already, I can push down. For this leg, when I do push, I get that piriformis stretch. So because of where I am tight on this side, I can get a little bit of a piriformis stretch just by pushing down towards the floor with that knee. Now, when I'm going to hug my leg, this one especially, because it doesn't want to go into the correct position, really have to hold on to it for dear life so it doesn't try and run away from me. If I don't, my foot goes flying down to the floor, okay? So for this, I've got both hands, one is at my foot, one is at my ankle, to really secure it because this leg is a lot tighter. I'm gonna lean forward towards my leg still, but I'm not gonna be able to come as far forward as I did with the other one. So if you look, this is as far forward as I can get. I'm feeling that stretch really deep down in my butt cheek right there. I can't necessarily come as far forward as I can other leg, which this one I can go all the way to there before I feel that same stretch. Same place, down in my butt cheek on the left side, but I can come a lot further because I'm not as tight in that hip. Okay. Then for our ankles, ankle mobility, so we just want to do circles. So just bringing our foot up in front of us. You can do it a little bit lower, doesn't really matter. I just wanted you to be able to see my actual foot. And we're just doing circles. Clockwise, counterclockwise. If you feel real fancy, you can try and spell your name. So basically, you just want to get that ankle movement in all sorts of different directions. And then the last one we're going to do is our diaphragmatic breathing. This one I like to time with some upper extremity movement. So as I bring my arms up, I'm taking a nice deep breath in to my diaphragm right below my rib cage. So I want to go. And then as I bring my arms down, I'm going to exhale. So the reason I like the arm movement is we get a little bit more expansion through our trunk. It gives us more room to expand into our diaphragm when we're bringing our arms up. And naturally, as we bring our arms down, it's kind of compressing all of that. So that is how we can kind of initiate the inhale and exhale with our movement. So trying to really focus on our breathing in as we go up, breathing out on our way down.